Well, a mutation of the Delta variant called Delta Plus is now spreading in 11 countries, raising new concerns about the impact of the efficacy of COVID vaccines.
Here to answer your questions is Dr. Mark Seidner, the epidemiologist within the Department of Infectious Diseases at Mass General Hospital. Dr. Seidner, thank you so much for joining us this morning. We do want to ask you, how is the Delta Plus variant different, and is it more dangerous?
So we're still learning about this AY2 or so-called Delta Plus variant. It's definitely one that the scientific community is watching. But I think what people should know is that as long as vaccination rates are low pretty much anywhere in the world, the virus will continue to spread and these variants will continue to emerge. We know that the parent virus, the Delta variant itself, is spreading here in Massachusetts. It's being seen in about 10 to 20% of cases currently. It's clearly more contagious and it appears to be more severe, particularly in young people. So for those among us who have yet to be vaccinated, I think, especially among the younger folks, I think this is something you should be keeping your eyes on.
Okay, we know people who are immunocompromised may not get the same protection as the rest of us from COVID vaccines. A new study suggests a third dose could be the answer. What do you think about that?
There have been a couple studies out recently in these people with severe immune system problems, and they've been reassuring. So in this study, organ transplant recipients got a third dose of the vaccine, and the rates of response increased from about 40% to 60%. Not perfect, but reassuring. I think these data are teaching us that there are going to be some specific populations who need more vaccines than the rest of us.
If the protection is better with a third dose, at least in some cases, why doesn't everyone get one, or is it possible to have too much vaccine?
Yeah, so the flip side here is that in the vast majority of us, over 90% of us, clearly the current vaccines are working. We've seen that in the clinical trials, and now we're seeing that in real world data. These vaccines are preventing 90 to 100% of hospitalizations and deaths in most of the world. So although boosters may eventually be needed based on these variants or if our immunity wanes over time, for now the data shows these vaccines are working. Not much of an advantage for people to get a third dose, particularly while there's still global shortages of the vaccines.
Okay, well, this Thursday, registration opens for the state's Vax Millions Getaway. Do you think this contest is going to help boost vaccinations, especially among young adults?
You know, we're learning that there's a wide range of reasons why people don't get vaccinated. Some have lingering questions, and hopefully information sessions like these and others will help to address their concerns. There are people who've had a difficult time accessing vaccines for work schedules or childcare schedules. And it's great to see that VaxBus you showed or these other vaccination at home programs in Massachusetts to address people who've had these challenges. But there are just some who just need an extra nudge. And I think now in Massachusetts and in some other states, there are a million more nudges out there for those who need that. And hopefully this program will get more people to line up across the finish line and get our vaccination rates up higher.
The numbers continue to tick up. All right, Dr. Mark Seidner, epidemiologist with the Department of Infectious Diseases at Mass General Hospital. Thank you so much for joining us.